So you need to see a healthcare professional that isn't a GP. But do you need a referral from your GP to do it? If you're struggling to answer this question, get this done, or don't know where to start, have no fear. I'm going to go through everything you need to know today, step by step. So for this, we should start with what a referral actually is. A GP referral is a usually written communication from your GP to another medical professional seeking their help to assess your needs. GPs make referrals because they believe your symptoms need the assessment and further investigation by a specialist. But do you actually need a specialist? It might sound obvious, but GPs can deal with a lot of medical problems without the need for an additional service. For example, most skin conditions can be dealt with by your GP without the need for a dermatologist. But let's just say you know that already, you've considered it, and yes, you do actually need to get a referral. Before you do, there's a couple of important questions you'll need answered first. So why involve the middleman at all? Can't you just arrange the appointment yourself? Well, it turns out sometimes you can. It's area dependent, but in general, the NHS services you can refer yourself to include sexual health services, mental health services like talking therapies, drug and alcohol services, antenatal care if you're pregnant, stop smoking services, the emergency department, and a dentist. You might even be able to self-refer to physiotherapy, continence clinics, podiatrists, amongst others. I've got some links below with some more information, but private referrals are a little bit different. So you shouldn't do, but realistically more often than not, yes, you will. Your insurance company might want it for money funding reasons, and the specialist will require it for medical reasons. You see, your GP knows your medical history and is best placed to pass on all that useful information to the specialist. Right, so you've decided you definitely need a referral from your GP and it's time to get it done. First, consider whether it's an NHS referral you're looking for or a private referral. First, let's do private referrals. If it's a private referral, make sure to contact the private provider first to figure out who and where you want to go and get seen. Involve your insurance company too if you're not self-funding. Now, this I think is the best way forward for getting the referral from your GP. Contact your GP, ideally online. You should be able to do this with any GP in the country, and the details will either be on the NHS app or the practice website. It's best to do it online because you can provide more information, and sometimes enough information for the GP to do the referral without an appointment. But make sure you include who you want to be referred to and the reason you want to see them, along with a paragraph about what your symptoms are and what you've tried. You'll find that often your GP is happy to do the referral based on this information, especially if they've seen you before or have an idea of what's going on. For NHS referrals, it can be a little bit trickier, and that's because sometimes we have certain criteria we have to fulfill, and our secondary care colleagues will probably have expected us to at least have tried a couple of things first. That being said, it is dependent and different with every case, symptom, and reason for referral. For me personally, I typically want to see a patient most of the time before doing an NHS referral. That is, unless I'd seen them a few times before, the story was quite straightforward, or that was going to end up being the plan anyway. But long story short, if you need an NHS referral, there's a good chance you're going to need an appointment to see one of the clinicians at your general practice. So, assuming your GP has agreed to refer you, your work here should be done. Your GP will arrange for a letter to go where you've both decided. They'll include your personal details, your past medical history, medication and allergy details, as well as your current story and struggles with your symptoms, and why the GP would like the specialist to see you. Oh, an important thing I should mention is that NHS referrals are free, but more often than not there's a charge for private referrals, so make sure to ask about that too. Your NHS referral will then go to the hospital or the specialist that you've agreed to send it to. If the referral is successful, the specialty will contact you within a few weeks to let you know what the next steps are. Even if there's a long waiting list, they should contact you within that time frame. So, what if your GP says no? and they refuse to refer you. So whether it's a private referral or an NHS referral, your GP will only refer you if they feel it is clinically appropriate. They're under no obligation to actually do the referral if they feel it's not appropriate. If you disagree with your GP, you could always ask for a second opinion. Now, by and large, you'll find that GPs are a reasonable bunch, and they want to keep you, their patients, happy and healthy and come up with a plan that suits you both. So that's it. Thank you very much for taking the time to watch the video today. I hope it's been useful, and I'll see you again soon.